And so please feel free to keep entering questions into the Q&A, and we'll aim to get to as many of them as possible. So the first one that I will start with is from Emmanuel Abreu, and they ask, can you please expand on generalizability versus inter-rater reliability and intra-rater reliability? How can you guarantee your results are replicable? And I'm actually really glad that you asked this question, because it's one that comes up really often, and one it's an example of reviewer comments that we would often get, similar to the ones I showed in my slides earlier on. And so I guess what I want to say is that qualitative research doesn't aim for statistical significance. We aim to provide in-depth understanding and knowledge about a smaller group of people. And we also don't rely on, this idea of objectivity. We don't aim to be objective. That's not a goal, of the methodology. So replicating results is really not part of how we evaluate its quality. And so it's not something we pretend to do and don't do and should have done. It's just not part of the approach. Were there any other panelists that wanted to comment on that, Fiona, or?
No, Perry, I think you summarized that very well. And each of the different methodologies, in fact, have different criteria for evaluation of their quality. So there isn't even a one-size-fit-all evaluation criteria for all the different methodologies. So just something for people to keep in mind as well.
Absolutely. All right, well, I'm going to jump into a question for Craig Dale from Carla Rousseau. Thank you for presenting your interesting research. Can you elaborate more on the use of techniques to elicit discussion on pain, recall, and feelings about pain? It's challenging indeed to get patients to explore their pain and elicit deep discussion at times during the clinical encounter.
Great question. And I would direct you, first of all, to an author named Keith Barton, who's written in depth about elicitation techniques. And there actually are a wide range that you can use that might be applicable to the clinical encounter. So what I was using was maybe called object elicitation. And I think what you can do clinically, first of all, I have to say that sometimes patients just simply can't talk about this at a point in time. And so in my work, I wouldn't press somebody to talk about this if they seemingly can't. But if they're willing to work with you, you can do ordering or sorting kind of stimuli where you ask patients to talk about maybe different activities and level of difficulty that they can or cannot accomplish. That would be interference. There can be projective, kind of think aloud things where you ask people to sort, what if you were to do this, what would happen? There's freestyle sentence completion, which is a form of elicitation where, finish my sentence. If we were doing this, blank would happen. And there's think aloud. So although this is maybe more difficult to do if you were walking with a patient or traveling in the clinical environment with them, you can ask them to show you things like how they accomplish things like stairs, and to talk aloud, explain to me what's happening while you're doing something. And those are also elicitation techniques which can be very active and maybe rich in the sense of the kinds of data that can come out. So hopefully that's helpful.
Excellent. Thank you so much, Craig. I think I'm going to jump around with some of the questions in the Q&A just so that we can hear from a mix of speakers. And so just because I haven't gotten to your question doesn't mean we won't get to it. I'm just jumping around in the list, so not necessarily in order. So Tamar Wildwing asks, how can we ensure we are not being descriptive in our analysis of our data, but giving our participants voice by interpreting their views? And I also really like this question because I feel like that's at the heart of, high quality, deep and rich qualitative data analysis. Fiona, would you like to touch on this one?
Certainly. So it is a great question, Perry. So I think of the point at which you've gathered all your interviews and you've begun to organize some of that data, and you sort of organized it into buckets that are descriptive, that say some people said this, some people said that. That's only the beginning point of your analysis. So it's certainly not the end. So sometimes you do read qualitative studies that are simply descriptive, and they sort of lack that interpretation and analytic depth that helps us make sense of people's experiences, that pay attention to language, for example. Why did this particular group of people describe things the way that they did? So that kind of thought has to go into the analysis. And also, this is where theory can greatly enhance the quality of the research.
Great answer, Fiona. Fran, I'm wondering if you can address this comment by J.B. Miller. Can you say more about your preliminary answers to the important ethical questions you raised about using online data?
Okay, perhaps it would be useful for me to sort of talk about some of the things that we did to address those ethical issues, because actually one of the things that we realised as we started to look at the data was actually you can see who people are when you're looking at data. So what we actually decided to do was to sacrifice some of the verbatim words of people in order to retain their anonymity. And again, we could be criticised for this, and the full details of it are in the paper, but we felt that this was really important. So what we did, referring to what Fiona was talking about there, we discussed and agreed upon what the essence it was that people were saying, and we rewrote people's words, very much working together to make sure that we weren't moving away from the essential meaning of what people were saying. But we did have, if you look at online data, and more recently I've been working with interviews also with older people, where they just, you can see who they are in their words. You don't, just taking people's names away and where they come from and what hospital they go to doesn't make them anonymous. So that's a key thing to think about, not only in online data, I think, is about the difficulty that is in anonymizing people, and that I think is a key ethical issue to be considered.
Great points, Fran. And I don't think there are, solid answers to these questions. This is an evolving space. This is an innovative use of qualitative research, and something we were excited to feature in the special issue because it was so different. So I think it's a space that we have to keep watching for best practice and things like that. I want to move to this comment or question by Carla Rousseau for Sheila and Fran, and maybe we'll start with Sheila first and then Fran. Can you elaborate a bit more on the arts-based framework, research framework, please? I'm collecting art done by persons experiencing low back pain in an attempt to understand the affective components, and would like to know more about this approach. So perhaps just a few words about your approach and maybe some resources that people can access.
So thank you very much, Carla. I have learned so much doing this actual study, because the intent was I revised an earlier screening tool for the early warning signs, and then I had in my mind at the very beginning of this study to conduct a supplemental analysis using arts-based research. So my intent was in the forefront, and I think that has to be part of your arts-based research design. It's your intent of what you want to gain from your research question that links to the qualitative inquiry, and then the use of arts-based in an iterative, organic way of discovery, and being open to that. It's not like an add-on per se. It's definitely from the beginning thoughts of where you want to go with the actual research. An awful lot of qualitative inquiry with the beauty of using arts-based informed methods is that it allows you to open up what you want to find out with regards to your research question. And so we know from the literature, like Patricia Levy, in terms of the qualitative handbook, and where methods meet art is certainly a great beginning in terms of immersing yourself in the various different genres of arts-based framework and methodology.
Excellent.
Shall I add some things there, Perry?
Yeah.
Well, certainly something that would be useful to tweet is that or look at is the articles by Lefrenier and Cox, and I can certainly get those out. I've only started thinking about these things now. One of the strengths that I'm finding with arts-based approach is that actually, as I talked about in the presentation, of that sort of knowing happening at the interface of things. So people are looking at art. For example, recently I'm doing a study actually working with school children who are painting themes. They're painting themes from a study on aging. And during the process of them painting, we're discussing their views about aging and developing their ideas as part of the process of interacting with the themes in the art. So I think art-based approaches are really good at that sort of dialectic process of knowledge, and I think it's really, really strong. I think that's one of the ways where qualitative research really has its strength in getting people to think and to know through a process of interacting with research. That's really powerful for me.
Absolutely. Joletta, I was wondering if you wanted to comment as well. No pressure, but
yeah. Well, and it's interesting, and just hearing, and seeing Sheila's presentation with all of the artwork, and even in Fran and I's presentation, we had art on the last slide, and talking about how to evaluate qualitative research. And it made me think of my very first presentation that I ever gave. I used all artwork that was created by people who had lived with pain, because back then I was still in a really difficult place, and the artwork could speak better than I could to my own experiences, and was what really helped me to explore my own experiences. And through that art too, felt recognized and seen and heard in all of those things, and have become good friends with a couple of people who are artists in the pain art, if that's a category, space. But I just think it's such a powerful thing, and it speaks to some of what Craig's talk was about too, that it can be so hard to give voice to your experiences, and sometimes art can help us to share what those experiences are in ways that we can't put words to yet.
And I just wanted to add to that as well, Joletta, you say a very powerful thing in terms of, using arts-based or art. It opens up the ability to have that creative space of understanding and meeting someone, and recognition of, in our case, pain, and what that means is huge. And because oftentimes language is so limiting or perhaps prescriptive. And I think it really is an opening up for us in terms of our level of understanding at a very heightened sensory way. It allows for intimate storytelling about pain.
Great point. I think this. Sorry, go ahead.
I wondered, just making me thinking as you're talking then, is the other sort of powerful thing about using art and film and poetry is that when as viewers or listeners we approach art, we sort of want to change, we're looking for meaning. So you've got a very, very receptive audience who are looking to change, who are looking to understand. And I think that's a really strong thing as well about these approaches.
Absolutely. And I think that's at the core, of qualitative research, is trying to understand experience and recognizing that each of our understandings of someone's experience are going to be different, and that's okay. I think that's something that we have to just be okay with. This, I think, leads nicely into a question from Marie Figueroa for Craig. She says, you mentioned that some of your participants may have had PTSD from their time in the ICU. Did you see that any of the instruments you showed the participants acted as trauma triggers for them? And Craig, I'm wondering if you could also comment on that fine line that exists between qualitative research, but also being cognizant of mental health and having, safety plans in place for people talking about difficult experiences.
It's a great question. And just to clarify, in my research plans, when I interview people, I always devise a set of steps or a sequence if somebody seems especially distressed, to offer them support within a network of caregivers within the facility in which I'm working. And so that was active in this particular study. I need to clarify that many patients are identified as having post-traumatic stress disorder across the literature post-ICU. We weren't measuring it in our study because, of course, we were doing more qualitative and pain-focused investigation. I can recall only one participant who really didn't want to look at the tools when we arrived to do the interview, and they asked me to put them away. And what we say in qualitative research is that everything is data. And so what I learned from that interaction was that that was really an important gesture in the sense that there was something important in that fact that they wanted not to look at them, and it was too powerful of an experience. And so I had to more gently access some of their recollections in response to that about oral care and what happened for them in the ICU. They were still able to talk about the experience, and that particular person was very angry about the oral care experiences they had as being very transactional, very mechanical, very uncaring, and there is something happening in health systems around the world around, fundamental patient care of the body and the person that is, there's a disjuncture between what people expect and what's actually happening. And we've seen many examples of these, and these are considered health system failures, and pain is often at the center of these things. So this is a really good way of accessing those experiences. And in tandem with what was just discussed about arts-based materials, these kinds of data can be central to change projects within units and health programs in hospitals, and because they can become the starting point of an action research project, which is essentially a qualitative project that builds up into a purposeful change that begins with the patient experience. So all of these kinds of experiences are helpful. So I hope that answered the question to a degree.
That was a great answer, Craig. And I just want to add one thing to that around the piece about, making sure that we leave materials or other forms of support to people when we talk to them about sensitive topics. I think our REB boards, and that's our research ethics boards, often have an obsession with the imagined fragility of the people that we speak to. And I would say in most of the research studies I've done, people are actually quite strong, and they are leading very difficult and very painful lives. And it's not the retelling of that that causes the distress to them, but the actual living of it. So I just want to flag that as well.
Absolutely. I was actually just on a paper led by Dr. Lauren Heathcote at Stanford looking at distress ratings from research participants before and after qualitative interviews on a sensitive topic. And in the study, we found that all but one didn't have changes in their ratings of distress. And so we can't be afraid to ask people about sensitive topics. Many people find it cathartic to talk about things that are happening to them. And so, yeah, I think it's just being sensitive and thinking about these things. Because as Craig said, like there will be some people who find it difficult, but for the most part, I think it's a cathartic experience for most people. So I want to pivot to a question here from Hem Devin for Fran, Joletta, and I think for Sheila as well. Thanks so much for this exciting work. With increased demand for researchers to demonstrate research impact, is arts-based creative methods are the way forward for qual researchers?
I could start there. I certainly think they are a very, very powerful way forward, and one of the reasons is because they can sort of appeal to anybody, so they make it more, the research process almost a bit more democratic. You don't have to even be able to read to access the findings from these forms of research. They are very powerful and they are very interactive. So I think they are certainly one very powerful way forward, in combination with other things. I think a combined approach, some people will not be responsive to arts-based approaches, and I think we need to consider that as well. It's not the only way forward. Clear, analytical writing and that kind of thing are also important.
Violetta, would you like to go next, or Sheila?
So thank you, Fran. Yes, I totally agree. I really think that it really helps in terms of that multidisciplinary, interprofessional, and a global ability to connect in an artful space, to visit uncomfortable, comfortable social issues that is welcomed by everyone. And I think that arts-based research, because it is an iterative, organic, growing reality in terms of knowledge dissemination to increase that public scholarship that everyone can kind of identify with, in terms of, that picture. It will evoke meanings that are specific to you. What is important to realize, I think, in terms of the far reach, is that there is no certain language to art. It is it's through dance or music or poetry or film, or there's so many different avenues to speak someone's story through, and it's based on robust qualitative and quantitative methodologies as well. I mean, they concurrently can live in the same space, I think.
Yeah, and I was just going to say too, what Sheila was just talking about in terms of that public reach that arts-based research can have, I think is huge. And these are things that people in the public, whether they live with pain or not, can connect with in a different way than they can other forms of research. And I think that in itself is really powerful, and as a way of getting more of the research into the public sphere and having more public engagement with it. And perhaps more discussions that don't even occur in an academic setting, but between people that they find meaningful and can start making meaning of their own experiences because they saw a video on YouTube where they saw themselves represented, where they could interact with other people in the comment section that have a similar experience. Like, that is really powerful stuff. And people are searching for that level of connection and feeling understood, and also trying to understand their experiences. So I think that and like Fran said, it's not the only way forward, but I do think it is a powerful way forward, and should be included.
If I could just say one more thing, Gillette, I think you again raised some great points. Our participants in our study, we did some member checking with them to make sure we weren't off track, and they felt very delighted that their stories were going to help others, and also that it validated what they went through. And I think that was very powerful for me as a researcher, that there's the meaning for me. And I think that's very important to be cognizant of as well.
And not to keep going, but I think that's so important to recognize too, that so many people do want to help others, and then they gain so much from that as well. So
Absolutely.
All the things.
And it's just such an accessible way, I think, for people to participate, and more of a meaningful way for some people. I think this question flows nicely into two questions that are related, so I think we can answer them jointly. One's from Melanie Knoll and one is from Hem again. And so Melanie says, fabulous webinar, and it's exciting to see this rigorous and invaluable research highlighted. How do we shift the field to increasingly value this critically important work? These webinars help, and are there other ways? And Hem says, for the panel, what are the key steps for us as qual pain researchers to move this methodology forward and contributing to the pain field in general? And I've just been alerted that we do have 3 minutes left, so perhaps this will be our last set of questions to be answered. And I apologize for those who didn't get their questions answered, but we can address them separately from the webinar. So Craig, would you like to start?
Great question.
With some thoughts.
I think if your qualitative methodologies are very diverse in terms of what Perry and Fiona talked about at the introduction. So be really clear on what your methodology is, its origins, and the kinds of theory that are operating there, and occupy that space proudly. Write really clearly about the benefits of that approach versus other approaches. And in terms of the larger health system of funding for research, I would, for those who are working in reviews and funding, to really look at the opportunities and argue for a space to make sure that there's funding for this work, that will keep it alive and expand it. And also, when there is a lot of money put into quantitative work, argue for a qualitative component to accompany it so it's translatable. So we actually understand what all the numbers mean in the human terms, and we create a better balance that's accessible to the public. Because I think ultimately our research needs to reach a wider audience, and it's not just other healthcare providers and researchers. It must be understandable or comprehensible. So funding in this way needs to think about the ultimate translation, which is what Fran and Joletta and Sheila are doing, in the sense of making sure there's other ways that just don't have to do with reading. We need this to really move forward. So the KT piece is where the qualitative work can really help.
Absolutely. Fran, would you like to comment next?
I suppose important things for me moving forward is to just really, as a qualitative community, maintain the sort of quality of our analytical work. This goes back to what Fiona was talking about earlier, moving beyond descriptive studies and really looking at the essential characteristics of our data, and speaking about that very, very clearly in whichever way that we decide to present it. I think they're really important things in our own work, and encouraging students and in our reviews of other people's work when we review people's work for journals and things.
Absolutely. Sheila, would you like to comment next?
So thank you. I'm just thinking about, pragmatically in terms of the educational exposure to arts-based research, and all of that in terms of how we educate the up and coming, and perhaps developing an arts-based qualitative community of interest, and to foster that level of research expertise, tapping into experts, and to be able to provide that level of exposure or invitation onto various different projects to learn with each other, with each other. I think that's something that we can do as a community, certainly of qualitative researchers. Something to think about.
Great food for thought. Joletta, would you like to comment?
Yeah, I just, one of the things that I greatly appreciate about qualitative research is it seems like they're well ahead of the game in terms of including people with lived experience and people from the community in that research, and that hopefully that will then start leading to different ways of implementing that research into practice and into the real lives of people living with pain. And I think that the more that we can demonstrate those things, the more people will want to fund qualitative research, because it will be making an impact in patient lives, which then makes an impact in healthcare and economical costs and all those sorts of things too. But grounding it in that patient experience and those lived experiences, I think, is so incredibly valuable, and hope that more people get into it, and that more people read it and do things with it, and all of that.
Excellent. Thank you so much for sharing. And Fiona, would you like to close out this important discussion?
Yes, those were such great answers. There's very little I can add to that, except to say for myself, it's been working with truly interdisciplinary teams. I'm greatly indebted to the interdisciplinary researchers who have worked with me on qualitative studies, who promote its worth and value. So I would just want to end with that. So this has been a really incredible opportunity. Perry, working with you, co-editing this special issue has been a joy, and I've learned so much from you. You are wonderful.
Likewise.
Thank you. And thanks so much to our presenters today, Craig, Sheila, Joletta, and Fran. Everyone on the webinar, thank you for being with us today. And I really encourage you to read all the articles in the special issue. And I guess I should also once again thank Dr. Joel Katz, who's the editor-in-chief of the Canadian Journal of Pain. So thank you and goodbye.
Till next time.
Yes.